Coming up on KCCI 8 News Close-Up, controversial changes moving fast this session. We'll hear from Iowa Senate Majority Leader Jack Whitver on the major bills passed in the first month.
And gender identity in school, the restrictions Governor Kim Reynolds' education bill could put on your kid's classroom. Plus, Uber for EMS, the pilot program that hopes to bring faster emergency services to rural patients.
This is Iowa's news leader. This is KCCI 8 News Close Up.
Good morning and welcome to Close Up. I'm KCCI Chief Political Reporter Amanda Rooker.
And I'm Chief Investigative Reporter James Stratton. Thank you for joining us on this Sunday morning. This year's legislative session is hardly a month old, and lawmakers have already passed several major, sometimes controversial, pieces of legislation.
And that includes a new law using hundreds of millions of taxpayer dollars to pay for some Iowans' private school tuition. And another bill passed caps how much money medical malpractice victims can get for their pain and suffering. I sat down with Iowa Senate Majority Leader Jack Whitver to talk about how these bills made it across the finish line so quickly this session, when those same issues have stalled for years at the State House. The House and Senate both just passed forward a bill that would cap how much victims of medical malpractice can receive for their pain and suffering at $2 million for hospitals, $1 million for other healthcare providers. It's something that the Senate has passed versions of in previous years. It's never been able to get past the House. What was it about this year that was different or special that you were able to find a compromise and get this past the finish line?
Well, really, it's something that we've worked on in the legislature for upwards of 20 years. And we've tried different bills over the last few years to try to help improve the provider business environment here in the state of Iowa. As you said, the Senate, we've passed some sort of tort reform in 2017, 2020, just haven't been able to get it down to the governor. But with the new makeup in the legislature and a lot of new legislators that were elected, finally had the votes to get that bill done this year.
What difference do you think this is going to make for Iowa's medical system?
Well, the reason we pass a bill like this is because we have concerns about healthcare providers in the state of Iowa, specifically out in the rural areas where we're losing hospitals, we're losing clinics, we're losing services, and part of it is the environment we have here in the state of Iowa. We have not been competitive with other states when it comes to these types of laws.
There's a similar bill moving through the State House that would limit non-economic damages on incidents with commercial vehicles. Do you see enough support to get that across the finish line?
I think that remains to be seen. You know, we wanted to work on the medical malpractice bill first. Obviously, we were able to get that done. A lot of the same people are supportive of both issues, and so we'll take a look at that starting next week and see if there is support for that to try to make sure that we have reasonable laws in place regarding commercial vehicles too.
Switching gears now to talk a little bit about education. There have been so many bills this session regarding education, but one thing that was a hot topic last session and this session is this conversation around books and what type of material should be in libraries. The governor just released a large education bill in which she suggests if one school district restricts or removes a book from a school library, that every school in Iowa should restrict that book, that then every school in Iowa, if a kid wants to check that book out, would have to get written permission from their parents beforehand. Is that something that the Senate would be interested in?
Well, it's obviously a conversation that has been going on since last year, and we had bills last year related to this as well. We did not find agreement between the House, the Senate, and the governor last year on this policy, but I know there's several bills that have come back this year that we're going to take a look at. But as you mentioned, education has been a really hot topic at the Capitol this year and even into last year. And so we understand the importance of strong public schools, strong private schools, and ultimately results for our kids. And so we're listening to concerns of parents, ideas from schools to make our schools the best in the country.
On that book piece, are you interested in kind of what the governor has laid out there, or do you have a different idea on how books should be regulated?
Well, on a lot of these bills, the governor, has put bills forward. She's put an agenda forward, and that's really the starting point on a lot of these ideas. And so, as that bill comes forward, I'm guessing we'll start off on her bill and vet that through the process.
Another topic that a lot of these education bills have looked at is restricting what can be taught in the classroom or putting restrictions on LGBTQ topics. In the Senate, there's a bill that would restrict content on gender identity and sexual orientation, kindergarten through 8th grade. The governor's plan has kindergarten through 3rd grade. What to you is the right age limit for that content in schools?
I'm not sure what the exact right age limit is. I mean, ultimately we'll have that conversation with all of our members in the Senate, have the conversation with the House and the governor to figure out what we might think is a reasonable law to put in place there. But it's definitely something that we've heard concerns from parents and we want to try to address.
Another thing that we've seen kind of the start of discussion over is what the penalties should be for schools if they violate these bills, if they turn into law. One bill in the Senate that just came through last week would create civil penalties, $10,000 to $50,000 for schools. What's the right number, or what is the right penalty for a school that would break something like this?
Yeah, just like previously, we had a lot of conversations about this last year. There was bills that would penalize, fine, put them in jail. I'm not interested in that. What we really want to do is have a good conversation with our schools, make sure that our schools understand the concerns of the parents, and make sure we put in place policies that works for everybody. And so really I expect a conversation over the next 6, 8, 10 weeks to see if we can find some common ground, something that makes sense for Iowans, that our schools can support and that our parents can support.
And one of those things as well would be letting parents know. Teachers, school staff would be required to tell parents if their child tells a school staff member anything about their gender identity or wanting to change genders. How do you strike the balance of, parental rights while also, there's been concerns that that could put some kids into a dangerous situation or create a child abuse situation if they have a dangerous home life? How do you strike the balance there?
Well, I think parents ultimately are responsible for their kids, and we want to make sure parents have a seat at the table. A lot of this conversation that started really frankly back when the COVID pandemic started, it was about empowering parents and making sure parents are involved with their kids' education, and that includes all these topics. And so I think ultimately parents care more about their kids than anybody, and they need to be as involved as possible.
There was very swift action from the Senate to correct a miscalculation around property taxes. That 2021 tax law had a miscalculation that would have over-collected $127 million from property taxpayers. We've heard that this was because there was a miscalculation in that bill, but who really is responsible for that mistake?
Well, I don't know who's responsible other than there was a number that was released that was off by 1% or 1.5%, and we recognized it. We want to fix it because ultimately it meant a $120 million tax increase for Iowans, and that's not something that we were interested in seeing happen. So we want to address it as soon as possible because cities are going through their budgeting process right now, and we wanted to make sure we got them the right information on what the tax rates will be before they get too far along in that process. And so in the Senate, we've already passed that. I'm hopeful the House will get that passed next week, and we can provide some clarity and also the tax relief that is not only needed, but was just the right tax policy and the right number.
And one thing that the House has talked about, as you mentioned, some cities and counties, they've already started their budget process. They received information that wasn't correct. They thought they had more money than they did, and some of them have already committed to expenses to no fault of their own. One thing the House has suggested is, still bringing that rate back down so taxpayers don't have to pay more than they're supposed to, but using the taxpayer relief fund to a one-time temporary payment of $127 million to these counties and cities who have to cut back to no fault of their own. Is that something the Senate would reconsider?
No, that's something we're not really interested in. And the reason is, number one, they have time left in the process to finish their budget. They'll have to adjust, but we're in the middle of session often, and March 15th comes around, we get a new budget number, we have to adjust. We push the deadlines back to give them time to remake their budget, but it's really important that we don't, as a second point, create a situation where we put one-time money in. Next year, if that money's not there, they're going to say, well, we're cutting state or we're cutting local government. And so we're not going to use one-time money on an ongoing expense. And that hole in the budget will be there if we take that money away next year and don't fund it again next year. And so we have no interest in doing the backfill. We think there's plenty of time left for local governments to adjust.
Coming up on Close Up, restrictions on LGBTQ topics in Iowa schools, the reaction to different plans from the House, Senate, and governor. Plus, Uber for EMS, the Iowa pilot program designed to get emergency services to rural Iowans faster.
Welcome back to Close Up. Thursday, Governor Kim Reynolds unveiled her sweeping education plan. It's the latest in a series of Republican efforts to protect what they call parents' rights and restrict what teachers can teach. Among a wide range of topics, Senate Study Bill 1145 would set up several restrictions concerning LGBTQ topics in schools. It would ban all talk about gender identity and sexual orientation in kindergarten through third grades. It would also require parents be notified if school staff believes a student has expressed a gender identity that is different than their biological sex. And the bill requires parental consent to refer to students by a pronoun that doesn't match the child's biological sex.
Now, as we talk about all of these different bills, I'm joined now by Damian Thompson from Iowa Safe Schools. Damian, you work a lot with LGBTQ plus students with different families and communities. What are you hearing from those communities about some of these bills and how it would impact them?
Yeah, firstly, I would like to start off and say it's the Midwest's largest organization serving LGBTQ youth. We work with over 10,000 kids in all of Iowa's 99 counties. And in this kind of false pitting of parents' rights versus educators, we're really losing the most important voice, and that's our students who are going to be affected by this policy change in the day-to-day, in our schools, in our communities. And by far, vast majority of these folks are opposed to this legislation for the harms that it'll cause.
Tell me a little bit more about that. We've heard talk about banning conversations around gender identity and sexual orientation in classrooms. We've heard, parents, the bills would require school staff to tell parents if students express wanting to change their gender identity. What are you hearing from students about the potential impact of those things?
Yeah, I would say both anecdotally and in the data, every time that we introduce one of these bills that attacks our LGBTQ students, we see increased rates of depression, suicidality, and less feeling of value amongst our students. So that's a major concern. But whether it's erasure in censoring school curriculum or putting students in direct danger by outing them to sometimes safe and unsupportive families, it's cause for great concern.
I want to mention one of those concerns that you brought up, potential for putting kids in dangerous situations if they have home lives that are not supportive of transitioning or their gender identity. The governor has introduced a potential solution to that, in her opinion. If a student expresses a gender identity that's different than their birth certificate to a school staff, the school staff, if they felt that could create a potential for child abuse, would be required to report that to the Department of Health and Human Services. In your mind, is that a solution to protect kids?
You know, I've talked with a lot of folks who have policy expertise in the child safety area. I've talked with my team, and really we find it hard to see how this so-called solution is workable. On one hand, you have an educator that would essentially out a transgender student, and on the other hand, if an educator or school professional feels that student might be in danger, we're going to have the state preemptively investigate someone before any founded abuse is proven, all in the guise of someone's gender identity. I don't know how you would do that discreetly without raising alarm with either the student or the parent. And really, at the end of the day, this is still taking away the agency of that student to tell their own story at their own time. We tell our students that they are the best judge of their own safety, not the state, not educators, not parents. It is the student's right.
Now, there's clearly a building movement across the country and in the state to try to establish more parental rights. As you mentioned, on the flip side, there's also some data around harm on the mental health of LGBTQ students with some of these bills. How do you balance giving parents more rights over their kids in the classroom while also protecting these LGBTQ students?
Yeah, I would first of all reject the dichotomy that's kind of been built around like it's us versus them. We as an organization work very collaboratively with our parents to make sure that even those that are willing to learn but aren't quite there yet, we're taking them and ensuring that they have the tools they need to support their student. It is crucially important when you do see that student support of parents those mental health negative statistics we just talked about really decrease substantially. So ensuring that, again, those parents have the tools to support their kids is crucially important.
And talking about supporting the population of kids, Iowa Safe Schools has a day at the State House coming up next week. Tell me a little bit about the information on that and what the goal of that day is.
Absolutely. So Tuesday, February 14th, we are going to be having our Iowa Safe Schools Student Day at the Capitol, which brings together educators, parents, students, and allies up to the Iowa State Capitol to talk about these issues and show the day-to-day effects of some of these policies that have been proposed and why our students feel that they are harmful policies. So we're going to give those kids the tools they need and the training to advocate and ensure their voices are heard up at the state capitol.
Damian, thank you.
Thank you.
And coming up next on Close Up, improving rural emergency medical services. How an app could change the way we think about EMS.
Welcome back to Close Up.
KCCI has shown you the issues that EMS services across rural Iowa face through our series, Essential. Let's take you back. The Iowa legislature passed Advanced Emergency Care Act in 1979. That set standards for emergency medical services, but that law did not deem EMS essential, like police and fire protection, meaning EMS is not a mandated service right here in the Hawkeye State.
In 2021, Governor Kim Reynolds signed Senate File 615 into law, and that allowed individual counties to make EMS an essential service. It also allows those counties to raise property taxes to pay for those services. In the last election, voters in 5 counties passed the referendum to fund EMS.
And recently, Iowa announced a pilot program to try to improve EMS coverage. Can an app and a change in mindset change how we respond to emergency medical calls? Lieutenant Governor Adam Gregg spearheaded the plan, modeled after a program in Israel. You call the upcoming EMS, rural EMS pilot program, Uber for EMS. Can you explain that and explain the program?
Yeah, well, I think that's kind of a catchy way of
Sure.
describing what we're trying to do. But what it really means is we're using technology to crowdsource emergency responders, basically helping us identify the 5 closest trained responders who are willing to respond when an emergency occurs. And by utilizing technology and by utilizing this new model, our hope is that we're able to drive down response times, especially in our rural communities. So we've got some funds set aside to test out this new model in at least 2 rural communities across our state, and really excited for the prospects of this.
And it came from an Israeli group. Can you talk about that Israeli group, how you got the idea and how you plan to implement it here?
Yeah, so last March I was on a trade mission to Israel with 5 other lieutenant governors. We had an amazing experience. We had the opportunity to meet with the then current Prime Minister of Israel, Naftali Bennett. We met with Benjamin Netanyahu, who at that point was a former prime minister. It turned out he was also a future prime minister, and he's now in that role. We got to see some of the holy sites. But maybe the most important meeting we had was with United Hatzalah, which is a charitable organization in Israel. Hatzalah is the Hebrew word for rescue, and they're really the pioneers of this model. And they've deployed this all throughout Israel. In Jerusalem, by using this model, they've driven down response times to about 90 seconds on average. And across the country, which includes some rural areas, the average is about 3 minutes. So I felt like this was a brilliant model that could potentially work in our rural communities if we tried something new and did things a little bit differently. And so I asked the question, I said, could this work in rural Iowa? We've got maybe some different challenges. And the feedback from United Hatzalah and their leadership was, yes, you ought to give it a try. So I came back, I was very inspired, had a conversation with Governor Reynolds, and she thought it was a great idea as well. She encouraged us to look at this through the lens of the Governor's Empower Rural Iowa initiative, knowing that we had some funds available to be able to support something like this. So we've had great conversations throughout the state of Iowa as we've put together this pilot program. And now the grant's open, and we're inviting applications from counties all across our state to be a part of this.
Leads me perfectly in my next question. Who can apply? How much money will they get, and how many will eventually receive that grant?
Yes, so we've set aside $100,000 to the Governor's Empower Rural Iowa initiative to support this, and that will support 2 communities. I say communities, it'll most likely be counties because of the way that 911 dispatch works. We're asking each of those counties to support it with a 50% local match. So in total, in each of the pilot communities, there'll be a minimum of $75,000 going to support this concept. And we suspect that that will help train and equip somewhere between 30 to 40 volunteers. If we're able to recruit some additional philanthropic support from businesses or individuals, that just means we'll be able to train and equip that many more people. And of course, the key part of this is the technology, using technology to identify the nearby trained volunteers. And so we've got a handful of technology apps that will be available. We'll let the communities decide which one fits best with their 911 system, and we'll go from there. Those app providers have been willing to donate that for the first year. And so that just means we'll be able to plug that much more money into training and equipping and recruiting new volunteers.
And I understand this is a pilot program. The final question I have for you, do you see this going statewide?
Well, let's see what the results are. I mean, the utility of a pilot program is that we can test something new and see if it works and see if it justifies further expansion. So we're going to look at things like, how does this impact response time? Are we, in fact, able to recruit 30 to 40 new volunteers at this level of training to serve their community in this way? How many lives do we save? I think that's a really important metric. And also, how could we sustain this going forward? So those are all things that we're going to look at through the pilot period with each of these communities, and that will help inform a decision. It could justify either a continuation in those communities, an expansion to other counties, and perhaps someday a regionalization of it, or even deployment statewide. But let's see how it goes here at the beginning, and it's kind of a no-lose situation for us. With a relatively small amount of money, we're able to test out this new program, see if it can work in rural communities, see if it can drive down response times and save lives, and if it does, well, let's consider further investment in that.
It's going to be a big idea. If it does get that far, we will be watching it every step of the way. We thank you for joining us this morning.
Thank you. Thanks for your interest in it and coverage of EMS services all across Iowa.
Wonderful. Thank you.
Thank you.
Still to come on Close Up, the Polk County case that could reshape mandatory restitutions.
Welcome back. Senate Study Bill 1069 was authored because of the voluntary manslaughter case of Piper Lewis right here in Polk County.
Lewis pleaded guilty to manslaughter in the killing of a man she says repeatedly raped her as a teenager. Under state law, anyone convicted of a felony involving the death of a person must pay $150,000 in restitution. The Senate bill would allow the judge to reconsider if the victim committed a crime against their offender. That bill passed through a Senate subcommittee. It now goes to a full committee for debate.
And we will definitely be watching that. We thank you for watching this show. This is KCCI 8 News Close Up.
We will see you back here next Sunday. Have a great day.